Alright guys, so it has been 33 days since the surgery, visiting Sinai again, Dr. Assayag. So the difference between this visit and the other one is that I do not have a wheelchair. I came in on foot. Of course, it's not as pleasing as to continue standing, but my point is that you can. You know, you can stand and you can walk around. Dr. Assayag have seen me. He's now seeing me after 2 weeks. And as soon as he saw me in the hallway, the first thing he said was he saw a difference. So like I said, people you're living with, they may not notice a difference because your height is gradually increasing. But people who see you after a week or two, they do see a difference.
It's a little more than that. Here we have 17. And through the mechanism, we have 13. So I think the reality is a little bit more like 13. Let's open it up. So you'll see the difference today.
Yeah.
Beautiful bone formation in between. Beautiful bone formation in between. So let's just position them a little. See the bone here?
Yeah.
And here in the front. I think it actually goes here. And that is that intercalary fragment that you can see here. And that is actually going to help us. And on the other side, and that's the right side. I don't see it as well, but I think she fried a little bit more the image. I would like to see a little bit more there. Okay, let's measure. Same thing. 2.8, but I think it's a little bit more than what we see here, just due to the anatomy of the femur. So all in all, you're doing great so far.
Nice.
Let's go back in the room and let's talk. How much time do you dedicate, do you think, to physical therapy daily?
About 2 hours.
2 hours?
Yeah.
Good. Any question or concern to start with? Or comments?
Well, for today, I had 3 particular things.
Yeah.
One was the refills. I'm out of everything.
Okay.
Second one was tightness. Is it possible to slow down, like by a quarter?
Yes.
Because I feel like I'm lengthening more quicker than I'm catching up, and I am trying my best. I have band at home, and I'm stretching all the time.
I'm glad that you're bringing it up.
Yeah.
Because both with what I'm seeing in terms of gait, but also with what I'm seeing in terms of bone formation on the right side, I want to slow down. So we're going to slow down to 0.25 3 times per day.
So 7.5.
0.75, exactly. And that will allow us to catch up a little bit.
Okay.
And we still have some leeway to slow down further, by the way. It's not a sprint, it's a marathon.
Yeah.
Where we have to keep the goal in mind. Perfect. You're wearing the brace at night?
Yeah. Now and then.
Not so much?
Yeah, not at nighttime, but throughout the day, like 15 minutes here, 15 minutes there.
So we try to aim for at least 8 hours per 24 hours. So the best yield is at night. And I promise you that in terms of stiffness, you will see a difference. I know it's a big torture device, but it works.
Okay.
It works. Perfect.
Taking a nap.
Perfect. Are you eating well?
Yes.
Perfect. Very good. Let's take off your shoes. And your socks. And then eventually we'll transition to here. So you can see his flexibility as he does that. Beautiful, 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 beautiful. So first things first. No, don't do anything. Just let me do. Relax completely. Perfect. First things first. He goes fully straight, but there's this spring in his hamstrings, and that's a very good idea to slow down. I promise you that this spring, if you wear the brace, will go away. Obviously, the ankles have been spared, if we're not lengthening the tibias. I still look at them. Close your eyes and tell me where I'm touching.
Yep, near the big toe.
Here, take this. I remember.
Yeah.
How about here?
Yeah, on the sides, on the top, on the ankle, shin, ankle, and the sides.
All feels normal?
Yep.
Very good. Push in my hand as hard as you can. Pull in my hands as hard as you can. Now just with the big toes. As hard as you can. Very good. Very, very good. So, a little bit of hamstring tightness. Quadriceps are still good, but you have to check them prone. Very good. Sorry about that. A little bit of tightness in the hip abductors and IT band. A little bit of tightness. Okay. Lay on your belly. And that's a real test. So do you spend some time on your belly? Mm-hmm. You do? Every day? Tummy time. Yep. And that's where it becomes the humbling experience for the quadriceps. So before, when you were sitting, it looked like the knee had good range of motion. Mm-hmm. But now that you isolate the hip flexors, so push your hips in the table. Perfect. So that's how you need to do the stretch, by pushing your hip in the table. Mm. Push in my hand. 1, 2, 3, 4, 5. Relax. We're gonna gain a little bit more. Push in my hand. 1, 2, 3, 4, 5. Relax. And we're gonna gain a little. Do that with the other leg now. And do it slowly, obviously. Mm-hmm. Push in my hand. 1, 2, 3, 4. Relax. See the difference? Mm-hmm. Push in my hand. Relax. Beautiful. Let's give this one another shot. Push in my hand. 2, 3, 4, 5. Relax. Keep your pelvis nice and tight. Yes. Yes. Some deep breaths. Now let's relax. And then you slowly go back to position. Well done. Every day. And you do that on both sides, so you can do the same thing with your hamstrings as well. You just do the other way around. All right. How's your experience so far?
Pretty good.
You're still happy you're doing it?
Yeah. Everything feels okay.
Beautiful, actually. So let's see the next side, and then let's look at the entry points. Take that away from you. You remember where the mark is?
It was right here.
Yeah, we can still see the thickness here. So I will let you with and obviously confirm with the ERC mechanism. Is there anything else I can do for you today?
So far so good.
So far so good?
Yeah.
Perfect. So
Very
prescriptions,
excited.
I'll tell you that when I saw you walk today in the office, I saw a difference. I saw a clear difference. So when we're not always with you,
Yeah.
we see a difference. Obviously, if you notice these things. Another thing I saw is that you compensate for your knee flexion by walking a little bit on your toes. Try not to do that because we don't want you to develop any kind of contractures of the ankle. But I don't want you to walk crouched as well. So that's where it becomes super important to really stretch those knees. Remember, that can be one of the breaking points. Bone formation, joint contracture, nerve symptoms. Those are the three potential breaking points. So work really, really hard on that. Awesome. Well, that's exciting.
Yeah.
Perfect. Well, in that case, listen. Are you hitting the road today?
Yes. Yeah.
You'll be going to PT with Assayag, and I will see you in time. If there's any issue in the meantime, you know where to find us. Okay.
We'll let you know. Thank you.
You're very welcome. See you soon.
It was a good visit. I'm glad that I was able to ask Dr. Assayag that if I can slow down a little bit. Like I said, I feel like my lengthening is faster and the stretches of my ligaments are a little bit slower. I will try to increase my stretches and therapy. Don't want to do any nerve damage. So from today, instead of 4 times a day, 0.25 millimeter, I'm just going to do 3 times, which means that total of 0.75 a day. So I'm happy with that. I'll take that any day over 1 millimeter and risk more pain. So I think so far it's going pretty good. All right, I'll talk to you guys later.